please. Stay seated. Look at me. You've been a naughty little Spätzle, haven't you? Do not turn this room into a house of lies. I know what you did. You think I don't know? Shh. I am very disappointed in you. You're supposed to be setting an example for the children. And what do we always tell the children to do when they get on a wheeled vehicle? We tell them to put on the brain bucket, the helmet. And you were riding an e-scooter without a helmet. Weren't you? Weren't you? Weren't you? Nod your head yes. Thank you. Now that we have cleared the air, we can begin. Now that we are being truthful with one another. Now, here's the good news. The good news is, my God, you're alive. There has been a dramatic increase in injuries and traumas since the introduction of the e-scooters in 2018. So there was a 160% increase in wheeled traumas since the introduction, and an overall increase in overall injuries across the United States of 21%. Let me repeat that. Overall injuries increased by 21% with the introduction of the e-scooters. Why? Because they're convenient. They look like fun. Oh, we had a scooter when we were children and we played on them, and we bopped around the neighborhood in the cul-de-sacs, and we jumped on little jumps, yes, you know, and we think, oh my goodness, look at this cute little scooter, little e-scooter, and I have my cell phone, and I can just tippy-tap my cell phone to the e-scooter, and I can run off at 15 miles per hour. It doesn't sound very fast, does it? It is. It is roughly as fast as you and me at a full sprint. I would like you to imagine yourself running down a street as fast as you can sprint, and just going ahead and smashing into a car or a wall at a full sprint. So, I'm very grateful that you're barely injured here, and that you appear to be of sound mind. Now, in the event that I might not be the correct doctor for you, I would like to give a special notice to the sponsor of today's video, ZocDoc. Now, look at me. What is ZocDoc? They are a free website with thousands and thousands of providers, professional, high-quality providers, with thousands of patient reviews, such that you will be able to find exactly the right kind of doctor that you want and need. You can find specialists. So if you need to find somebody who is an ophthalmologist, if you need to find somebody who is an ENT, perhaps a psychologist or a psychiatrist, perhaps you're looking for a general practitioner to be your doctor or your pediatrician, our friends over at ZocDoc will be able to help you scroll through, read thousands of reviews, and find a doctor that is just right for you. And if you would like to visit your doctor in person, which I do recommend, wunderbar. If you would like to do a video conference with your doctor, they can arrange that too, because there are certainly times when it's much more practical. You won't need to go into the actual doctor. There might be no need to getting a prescription refill. So there are many instances where you will not need to be physically there. And in fact, when you book an appointment through ZocDoc, it often happens within 24 to 72 hours, and sometimes you can even book a same-day appointment. So, if you're looking for professional medical care, check out our friends at ZocDoc/ASMRjeremiah. And good luck out there. Now, we'll start with what we always start with. Your heart. You want to listen to your heart. So I'm going to take your blood pressure. So, please start by breathing normally. Very good. 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 And take a nice deep breath for me. Very good. And take one more nice deep breath for me. Wunderbar. Don't hear anything rattling around inside your chest, which is good. Which is good. Now, look at me. Moving forward, are you going to behave? And quit being a naughty little spätzle, and instead be a good little schnitzel? Yes, you will, won't you? You're going to set an example for the children, and if you use these scooters as e-scooters or any kind of bicycle, you're going to put on your brain bucket, your helmet, yes? Good. Now, I'm going to take your blood pressure, okay? So, put out your left arm. And just roll up your sleeve for me, thank you. Relax. Now I noticed your heart rate was a little bit elevated, okay? That can affect your blood pressure. Are you feeling nervous by coming in to see me? Okay, take a deep breath. Calm yourself, okay? You're gonna feel a little squeeze on your arm. You've had your blood pressure taken before. Okay, now, I don't believe that was an accurate measure of your blood pressure. That said 130/85. Okay, that's a bit high. It's approaching hypertension. I doubt that you have hypertension right now. I think you're just nervous. You're a bit shaken up. Maybe adrenaline's get a bit high coming in to see the doctor. Look at me. Look at my eyes. Take a deep breath. Everything is going to be okay. Breathe. Everything's going to be okay. You're safe. It's going to be okay. You are going to be okay. Nobody here will hurt you. Everything is going to be okay. You're safe. Now, one more deep breath. Let's try this test again. Okay. much better. Much better. 121/81. This is much better. I still think you're a little bit in stress from being in the hospital. This is normal. Okay. Much, much better. Now, look right into my eyes. Okay? I'm going to check out your cranium. I'm going to check out your head. This is something that I want to do. Very typical after somebody takes a fall and bumps your head, especially without wearing a helmet. So I'm going to do what's called a little gentle cranial nerve exam. This won't hurt at all. It shouldn't hurt. If it does, if at any point in this examination you feel pain, you feel discomfort, anything at all, you have to let me know. Okay? I'm not a mind reader. I cannot feel what's happening inside of your body. So, you'll tell me yes. Good. Wunderbar. So just look straight at me, and you're going to see a little flash come into your eyes. Good. And one more time. Good. Now I'm going to check it on the other side. You're going to see a little flash. Good. Very good. And follow my pen light right across, just with your eyes. Good. Good. Wonderful. Okay. When you fell, how hard did you bump your head? Did you feel a moment where perhaps you lost your consciousness? No? Good. Good. Saw a little bit of stars, a little bit of like the little sort of circles that kind of go across your vision. Okay. Well, as I said, this is why the scooters are very dangerous. They look like so much fun. And it's something that, like I said, we've played on when we was kinders, the children's, and we remember them as being, quite safer even than the bicycles, because you lower to the ground. But you put them in a motor, and suddenly you're going 15 miles an hour. It's just a flick of the wrists and the throttles. And unfortunately, for the doctors and for the emergency departments, the ERs, emergency rooms, the e-scooters have been quite a disaster. Now, I'm going to touch your face a little bit. Do I have permission to touch your head and your face a little bit? Good. Well, it would be silly to not to. It's like asking, I'm going to brush your teeth, but I can't touch your teeth. Okay. Let me know if any point on your head, if you feel any pain. Okay, I'm just going to feel right here. Okay. No pain. Good. Here. Okay. Over here. No, good. And back here. Okay, good. And I'm going to feel it right here in your lymph nodes. Right there. And any sensitivity? No. Okay, good. And here. Okay. Now I'm going to place my hands on your shoulders. And I want you to shrug your shoulders up and let your shoulders drop down. Okay. Shrug your shoulders up and down. Good. Okay. One more time. Shrug your shoulders up and down. Very good. Now I'm going to place my hand on the left side of your head. Okay. Right by your ear. I want you to tilt your head into my hand from here. Okay. Tilt your head into my hand. Good. Just like this. Ausgezeichnet. And on the other side. Tilt your head into my hand. Good. One more time. Tilt your head. Good. Let's look straight at me, please. I'm going to place my hand a bit more on your cheek area, okay? And this time I want you to rotate your face into my hand. Don't tilt. Rotate into my hand. And rotate into my hand. Very good. It's on this side. Rotate into my hand. Excellent. You're doing great. Everything's going to be okay. You're going to be fine. You're doing wonderful. Okay. I'm going to place my hand on your forehead. I want you to tilt your forehead into my hand. And press into your hand with your forehead. Good. Very good. I'm going to place my hand under your chin. I want you to open your mouth like so. And open your mouth. Good. Wonderful. Okay. Now, we're going to do a little, make sure you have a peripheral vision check. I want you to cover up your right eye like so. This, cover your eye like so. And let me know if you can see my finger wiggle. Good. And good. And wunderbar. Same on the other side. Okay. And let me know if you can see my finger wiggle. Oops. Covering your whole face there. And good. 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 Excellent. Now I'm going to move my hands outside like so. Just look straight ahead at me. Let me know when you can no longer see my fingers. Okay? Just say yes when you can no longer see them. Good. And again. Yes, good. And again. Yes, good. Okay. Wonderful. Now, so far you're passing with the flying colors. Okay. So, I do believe you got very lucky. And this is a good thing. Okay? I'm just worried. I don't want to see you ever get hurt in a terrible way. I don't like seeing my patients in pain. Now, I want you to squish up your face very small like so. Very good. I want you to make a big wide face, big surprise. Very, very good. I want you to make a frowny face. Show me a sad panda. That's a very sad panda. Now, I want you to show me a big smile. Big smile. Good. Now what I'm checking for is to make sure that nothing is lopsided. If you smiled and you only went like this, this would be a big problem. Or if you frowned, it was just on the one side. It's good. Yeah? Okay. Alright, now, go and open your mouth and say, put your tongue out. And go, Very good. Very good. Okay. Have a closer look at your eyes and take a little check on your ears. Okay. Oops. Okay. This is much into softer light since the earlier one, but just look straight ahead for me. Just look straight ahead. And we'll get a close look in your eyes. Very good. Okay, wonderful. Now, just look straight ahead, please. And just look straight ahead. Okay. Good. Very good. Okay. And you wouldn't mind turning your head to the right. I'm going to take a look in your ear. And very good. And turn your head to the left. And be checking in your other ear. Very, very good. Okay. This is what we like to see. Now, we'll do a couple little hearing tests. Okay. I'm going to place my hands by your ears, and I want you just to look and where you hear the sound. So just indicate which ear that you hear the sound coming from. Okay. Over on this side, very good. And over on this side, very good. So both of them, good. I'm going to whisper a number into each ear, and I would like you to tell me is that number back to me. Okay, good. And 97. 97. Ausgezeichnet. And one more time. 21. 21. Wunderbar. Okay. This is all very good news. This is very good news. What it's telling me is that even though you had an oopsie, you had a little accident, and I'm sure you're going to have a few bruises, yes, and you may be a little sore for the next few days. The good news is you didn't injure your brain. This is very important. Now I'm going to do two more little tests. I'm going to do a little sensitivity test, and I'm going to do a tuning fork test, and just, you'll see. Sensitivity test. I'm going to touch some different parts of your face. There's a soft side, it's a cotton swab side. And there's a woody side, this will be the sharp side. And just let me know if it feels sharp or soft. Okay? Okay. Let me know what you feel. Soft. Good. Soft. Sharp. Good. Sharp. Good. Sharp. Good. Soft. Good. And soft. Very good. And now I'm going to do the super sensitive test. So I'm just going to take a tiny, tiny, tiny whisper. That was a cotton, just a tiny whisper. And just let me know when you feel it on your face. You can just say yes. Okay, just say yes when you feel it. Yes, good. Und. Yes, good. Und. Yes, wunderbar. Yes, good. Yes, good. Und. Yes, good. This is very good. Okay. No nerve damage to the face. And let me know when you can no longer hear. Here's a tuning fork, okay? You can hear this, yes? Yeah, you can hear this? Okay, good. Let me know when you can no longer hear it. Good. Okay, then on the other side. Good, very, very good. And good. Okay. Wonderful. Wonderful. For now, as I said, I do believe you've gotten very lucky today. Could have been much worse. I know it was scary. Falling off a scooter. I'm glad you came to the hospital to get checked out. And please, if you are going to use the e-scooters, please use a helmet, and if you don't have a helmet, just try walking. I know it's going to be slower. It's going to be so much safer. Okay? So, please be very, very careful if you're using these things out in the cities. And let me know if you have any, for some strange reason, if you have any persistent headaches, if you get any vertigo or any other malady that seems out of place in the next couple of days, you will give me a call, yes? Wunderbar. Okay. Okay. Take care of yourself. And be safe out there.